is, again, I'm going to use my caudal hand, and I'm going to be working on the tissues on the opposite side of me, but I'm going to have my thumb is really my dummy thumb that's going to go here, and then my left hand on the hypothenar eminence, and this one I'm going lateral. So the first one I was going cranially, and this one my mobilization is going to be lateral. So I put my thumb right there. And I start right here. I get on that muscle tissue, and I go out laterally. That okay? And again, anytime you're mobilizing, if it's just one spot, fine, you can do just that one spot. If it's multiple areas, you can work on this area for a while until you get the effect that you want. You can go up a little bit, or just find a different part of that muscle that needs the soft tissue mobilization. Okay?
That's for the multifidus as well, you said?
You'll see when we get to the thoracic region, this could be the paraspinals all the way up to the thoracic region. So yeah, this would be multifidus if we're like at the L5 through like S1 region, because that's what's more prominent. And then if you go any more superficial, if those muscles are guarded, yeah, you can work on them in the same way, but those are more the paraspinal muscles.
So do you have to go up and down first before you go side to side, or is that just...
No. Those are just two different ways to do it. No. And the next one I'll show you they're the medial mobilizations that we'll do. Yeah.
So why would you do one over the other? Did I break down?
Just two different techniques. You're mobilizing them in different directions. Sometimes one works better than the other. Sometimes you feel more comfortable with one versus the other. Sometimes the patient feels more comfortable with one versus the other.
Okay.
But they're all soft tissue techniques. So also step back and put them in the place where they need to be in your treatment plan. If today's the last day of their treatment, and it's their 10th visit, and you're seeing them for 10 visits, and after this they're done, you're probably not doing this. This is stuff early on to get rid of muscle guarding, to take care of that sort of stuff. Towards the end, it's going to be more functional activity. So this is always phase one. Okay, really any kind of mobilization is typically a phase one activity. It's going to be early on, and as far as do you do one versus the other, no, it's you may not be getting as good at as good at this technique, and you don't want to do that. It may not feel as good to her. You may have more control over your thumb, so you like to do it this way, or it may feel better to her, so you'll do it in the other way, in the lateral direction. So they're all soft tissue techniques, and they're just multiple ways to, or just giving you multiple tools to use.